Hi everyone, welcome to my channel. In this video we'll talk about blood coagulation. This is very important topic when we talk about exam or MCQ questions. Okay, so what is blood coagulation? It's spontaneous arrest of bleeding. Okay, we have to see all the mechanisms involved in blood clotting or blood coagulation. Okay, so those mechanisms are basically whenever there is injury to vessel wall, the first thing to occur is vascular spasm. Then platelet plug formation occur, which is a temporary plug, and then permanent plug formation occur, which involves some steps. First is prothrombinase formation, which is done by either extrinsic pathway or intrinsic pathway. Then that prothrombin is converted to thrombin, and which help in conversion of fibrinogen to fibrin. Okay, so one by one we'll see all these mechanisms. Okay, so starting with the vascular spasm. So whenever there is injury to a vessel wall, the first response is basically of blood vessel. First response is from blood vessels. So what happens basically, endothelial layer whenever injured, it secretes serotonin which cause vasoconstriction. Okay, so vasoconstriction is there. So whenever there is injury, if this vessel is injured like this, so there should be less blood supply coming out here. So vasoconstriction occur in this area. Okay, so vasoconstriction occur. Now the less blood is coming to this area. Okay, so first step is vasoconstriction. Next step is formation of temporary plug. Let's see how this temporary plug is being formed. So temporary plug is basically done by platelets. Now how platelet plug is formed? So it involves few steps. First step is platelet adhesion, then platelet activation and aggregation. So platelet adhesion, how it occur? Whenever cells, the endothelial cells, they are exposed to collagen. Here we are talking about a vessel. Whenever, so this is a vessel and which is having endothelial lining here, right? When this endothelial damage occur, whenever there is injury, so below this endothelial layer there is collagen tissue. So if this is damaged, here cells are moving, which are platelet cells, they are exposed to this collagen part. Okay, so what happens when collagen underlying the endothelial layer is exposed? What happens? There is one factor which is VWF. VWF is von Willebrand factor. Von Willebrand factor is released, which attaches to collagen on one side and it attaches to platelet on other side by some receptor, which is GP1B, 5 to 9 receptors. So this is platelet adhesion. So what happens basically, collagen on one side, VWF attaches collagen and platelet together. This is, so platelets are adhering to the collagen now. So this process is called platelet adhesion. Okay, so once platelet adhere to this collagen part, it releases some mediators which can be fibrinogen, ADP and VWF itself. So these mediators are released. This release of mediator process is called platelet activation. Okay, so once these factors are released, they attracts other platelets and cause their adhesion to the area. So many platelets are coming and adhering to the site and again activating and attracting more platelets. So ultimately that area which was injured is covered by many platelet cells, and this is called platelet aggregation, and that's how temporary plug is formed. Now next step is how permanent plug is formed then. So permanent plug formation. Step 1 is basically we need something which can activate prothrombin to make thrombin. Okay, and at last, why we need thrombin? We need thrombin to make fibrin, okay, from fibrinogen, and thrombin formation, to achieve this step basically we need prothrombin, and ultimately we need one activator of prothrombin. So first step is basically prothrombin activator step. Okay, this is also called factor 10. So formation of factor 10 is basically our first step, which is done by 2 pathway, and step 2 is ultimately once prothrombin activator is ready, it will activate thrombin, and thrombin will activate fibrinogen to fibrin conversion, so activate fibrin, and obviously that is needed for blood clotting. So let's see how first step is achieved. Prothrombinase formation. or prothrombin activator formation, right? It is achieved by two pathways. Now it depends on which condition injury is there. It can be extrinsic, it can be intrinsic. Extrinsic pathway, when blood come in contact with the tissue. Extrinsic, so whole tissue is damaged, whole wall is damaged. That means the blood is now exposed to complete outside tissue because of complete damage of wall. Okay, so that is tissue factor. So if extrinsic pathway is there, means there is complete cut in wall. Intrinsic pathway is basically when blood come in contact with either collagen or negative charge surface. So it can be achieved by just putting the blood in a test tube, negatively charged surface glass. Okay, so intrinsic pathway can be achieved this way. So how now what are these extrinsic and intrinsic pathway? So extrinsic pathway involve factor 3 and 7. So this tissue factor is basically factor 3. Okay, this is your factor 3. Now in presence of factor 3, which is tissue factor, obviously when complete wall is damaged, tissue factor is there. So factor 7 present in blood, in presence of tissue factor, which is factor 3, it basically activate factor 7. So factor 7 become activated factor 7, and now activated factor 7, it can activate factor 10 from factor 10, so become factor 10 activated. Okay, so 7 activated factor, it convert factor 10 to factor 10A, and this is called prothrombin activator. Okay, so this is very simple step. Factor 3 and 7 are involved in extrinsic. What about intrinsic? In intrinsic pathway, factor 12 is in inactive form in blood, which becomes factor 12A whenever blood comes in contact with negative charged particle. Intrinsic pathway starts. Factor 12 become activated, which further activate factor 11 and which further activate factor 9. Now factor 9 can activate factor 10 and convert it into activated factor 10. So this now factor 10 is a common pathway which can involve either extrinsic or intrinsic pathway to form. Okay, now ultimate goal is your factor 10, which is prothrombin activator. Okay, now step 1 is complete. Let's move to step 2, which is thrombin formation. So in presence of factor 10 and calcium, activated factor 10 we are talking about. So prothrombin become thrombin. Okay, which basically lead to starting of step 3, which is fibrin formation. Now thrombin, why we need thrombin? For conversion of fibrinogen to fibrin. Now ultimately fibrin is ready. So what is fibrin? Fibrin is basically thread like structure, which basically if this was the damage, okay, their platelet aggregation occur ultimately, and now what we need is, we need the fibrin meshwork to form here, and basically macrophages, they clear out all the debris here. So the plug form is a permanent plug, not temporary. Okay, that's how complete clotting occur in that part. Okay, fibrin meshwork form ultimately clot. So we don't call clot to a temporary plug, only permanent plug is clot. Okay, so we have seen complete process of clotting. Okay, you might have heard clotting time and bleeding time. So what is bleeding time? Bleeding time is the duration from puncture of a blood vessel till flow of blood. Okay, so that is basically from puncture till the temporary plug formation. We assess this time by bleeding time, and clotting time is basically from puncture till this clot formation. Okay, this is your clotting time. Fine, so you should be able to now differentiate these two tests and which mechanisms we are testing. So with the help of bleeding time you are assessing platelet function, and with the help of clotting time you are assessing all the clotting factors. Fine, you can be asked what is role of vitamin K in blood clotting. So vitamin K help in formation of factors, clotting factor 2, 7, 9 and 10, and synthesis of some protein C and S. So anticoagulants are also made by vitamin K. Okay, there are some coagulation disorders as well, like disruptive clotting can lead to hemorrhage, because if clotting process is not normal, it can lead to hemorrhage. Okay, hemophilia you might have heard, where factor 8 and factor 9 deficiency can lead to hemophilia, bleeding disorder. Purpura is a disorder when platelets are deficient, so BT is increased here, so which can be because of decreased platelet count, thrombocytopenia. Okay, so we have completed blood clotting this way. We'll see you in next video with next topic of blood. Thanks for watching, guys. Please subscribe if you like my videos. Thanks for watching.